Physical medicine and rehabilitation is a subspecialty field that has grown a lot in the last 5 to 10 years. It actually was born out of World War II when soldiers were coming back and needed a lot of physical therapy and medical oversight. So it's a newer field. I think our training is very neurology crossed over with orthopedics. So it's very unique in that way. There's a lot of different areas you can dive into, but some of the experience is just overall in medical complexity and rehab care, and then some of it's in knowledge of functional levels, as well as some injections and other things you can do if you're more in the outpatient setting. Personally, I chose PM&R as my subspecialty field because I loved the gym and I thought it was really nice to be able to give patients something other than just medication to help get them better. And I really liked being able to work with the families and the team environment that the inpatient rehab brings. So being able to collaborate with therapy and nursing and all the different specialties we have here, I think is what makes this environment really rewarding and also just a fun place to work. So,
Mhm.
like I said earlier, an inpatient rehab facility is still a hospital. So we are held to a much higher standard. So our staffing is much higher, both for physician and nursing, and rehab services are also much more frequent. That is different compared to the requirements for a skilled nursing facility.
Here in inpatient rehab, we tend to focus on a model that's 15 hours a week, whether that's within the kind of the normal range of 5 days a week, which is what we shoot for, which is 3 hours a day, and then split up by the disciplines that are in. So, speech therapy, physical therapy, and occupational. And in more of a skilled nursing facility, you tend to see a little bit of a different model. There's no set requirement for therapy, so patients tend to get a little bit less. This is the most intensive setting that we are in currently.